Hello, my name is Vincenza Spallone. I come from Rome, University of Tor Vergata, and I'm the present chair of Diabetic Neuropathy Study Group, Neurodiab. And we have just concluded our annual meeting in Thessaloniki, in Greece, and I think that we can say that this meeting has been very well accepted by the participants, and the participants were 165, coming from many countries all over the world. And the aim of this meeting was to address the present needs, gaps in the diagnosis and treatment of diabetic neuropathy. As the first point, we know that despite the fact that diabetic neuropathy is a very common complication, 2 out of 3 persons with diabetes may be affected by diabetic neuropathy after many years of disease. And despite this high prevalence, and despite the fact that diabetic neuropathy has a heavy impact on quality of life, we can think to the effect of neuropathic pain and also on the morbidities, the possibility that foot ulceration can develop, and in some cases this can lead to amputation. And also diabetic neuropathy has an impact on the cardiovascular morbidity and mortality, in particular autonomic neuropathy. Despite all this evidence of high prevalence, high impact on quality of life, and on also the survival and morbidities, this complication is the less diagnosed, is widely under-screened, under-diagnosed, and also under-treated also in people with symptomatic forms of diabetic neuropathy, as neuropathic pain, or by, for example, clinical manifestation of autonomic neuropathy as orthostatic hypotension, on urinary bladder dysfunction, and so on. The first point was to address this need of underdiagnosis, and some symposia, lecture, and also presentation have provided help to better define some already available diagnostic tools, as cornea confocal microscopy, as sweat function measure, as also the structure and the modalities, routine modalities to assess symptoms and signs, or also quantitative sensory testing, to provide a better definition on the diagnostic characteristics of these tools. But a more innovative point was to propose some particular strategy to fight the underdiagnosis, strategy to put together different modality of screening for different diabetic complication, and also the preliminary evidence that this strategy can be also used in different countries, different realities. Also, there was a definition, a better definition of small fiber neuropathy, and the method to study this particular form of neuropathy, and also how to characterize, phenotype the neuropathic pain with the aim to personalize the treatment of neuropathic pain. But also the the issue of a not completely efficient treatment of symptomatic form as neuropathic pain has been addressed, with both non-pharmacological approach, and we had a session on neuromodulation, and pharmacologic approach, and we have new data on these of new drugs, the result of the Lexicon trial in US, and also some indication of promising new agents with evidence from the preclinical science. And we had also some more new and I think topics that will be of increasing importance in the very next future, as the lecture on the effect of environment and exposome on diabetic neuropathy, and also some indication on how the socio-economical, socio-cultural, economic disparities can affect the risk of development of diabetic neuropathy. And I think that these two aspects will be much more relevant for people who, for research or for clinicians who take care of these complications. And other more innovative topics have been related, for example, to microbiome and the possible influence of microbiome on the development of diabetic neuropathy. But we have also we had also many good results from preclinical studies and research, and in this sense I'm very proud that this year we had for the first time a joint meeting with the Peripheral Nerve Society, and the topic was insights into the nerve damage in diabetic neuropathy, and we had very good, very intriguing, stimulating relation on this by Stephanie Aid, Daniela Menichelli, Zoltan Kender. So I think that there was a good mixture of results from preclinical science, attempts to provide response and helps for the problem of underdiagnosis, and also by offering a new perspective in the treatment of symptomatic forms. And we concluded with the presentation of the next annual meeting in 2024 that will be in Rome, Italy. Thank you.